Hello, I'm Dr. Fred Tenover, the Vice President for Scientific Affairs at Cepheid, and I'm here today to talk to you about some of the challenges, both for physicians and for laboratorians, with the upcoming respiratory disease season. Now we're going to have to deal with influenza, respiratory syncytial virus, and COVID. And why is that important? Because clinically, they all look about the same. Fever, headache, body aches, cough. A physician really can't tell one from the other. But what's important is they're treated quite differently. We have very good drugs for influenza, but those antivirals are very different from the antivirals that we use for SARS-CoV-2. And for respiratory syncytial virus, very important infection control implications at both ends of the spectrum for the very young and the very old. What that means is we need a diagnostic that detects all of those viruses. 5 things come to my mind. Number 1, we're going to need coverage for all of those viruses. Number 2, accuracy. Number 3, speed. Number 4, ease of use. And number 5, the power of PCR. We do not want to compromise on either sensitivity or specificity for all of these important viral agents. It's clear that PCR has become the go-to technology for SARS-CoV-2 detection, whether you're checking into a hospital or even taking an international flight. But that doesn't mean that every PCR test is the same. The Expert Express SARS Influenza RSV cartridge has become the market leader, and for good reason. It has the accuracy, it has the speed, it has that ease of use that works well whether you're at the point of care or in the main hospital laboratory. But for this upcoming respiratory season, what you really need is the combo within the combo. Everybody loves a combo. Chicken nuggets and fries, sausage and pepperoni, kale and quinoa. All right, well, maybe not kale and quinoa, but for diagnostic tests, it's the same. The combo is going to be the key to a successful diagnosis, especially when you have more than one respiratory virus that's circulating in the population. Okay, I know you might be thinking about those SARS-CoV-2 variants like Delta and wondering, is the expert test going to continue to be robust and pick up whatever variants may be coming in the future? We know we're good now for Alpha and for Beta and for Gamma and for Delta, even for Mu, but what about things that may arise in the future? It's a good point. So let me introduce you to Cepheid's latest test to receive emergency use authorization from the FDA. It is the Expert Express COVID-2 Flu RSV Plus. The new test has not just the 2 targets we currently have for SARS-CoV-2, but in fact 3 for that extra bit of insurance against mutants that may arise. In addition, we have the same 3 targets for influenza to capture all of the variants that may arise. Because remember, we've had to deal in the past with H1N1 versus H3N2, even the avian strains like H5N1, they're all covered in this cartridge. And we have ample detection of respiratory syncytial virus. It is the combo within the combo. The power of PCR Plus. Thanks. See you next time.